moving, which is the idea of actually a little bit more healthy living. Okay, stretch yourself. Okay, because I'm going to give you a big challenge now, and we'll sit down again. Okay, so just to remind everybody, we set ourselves a number of objectives for this event, as Trevor mentioned very helpfully at the beginning, but just to remind everybody, to get a clear understanding of the health needs of our population. Now, everybody here has got something to contribute. It's wonderful that there are so many of you here today, both my GP colleagues, but also people in some of our providers, and most importantly, you, the patients, the population that we serve. That's why I'm so excited about this afternoon. And we've got today a clear opportunity to help us review and adapt our current priorities. So if you see, and later on Anna Gillard is going to talk to us a little bit about what the priorities are at the moment, this is your opportunity to change it or put things higher up a priority list. And finally, we really want to know, how can you help us to achieve these priorities? Because this is what is different about clinical commissioning. It's about our population and the people who work with us in health, our colleagues, working together to actually get some better health outcomes for our population. So that's what I really want to have from this afternoon. Now, a little bit about our geography. As of course many of you know, we've got 3 local authority boroughs and 2 district councils, and our population is 592,600. And we're actually one of the largest CCGs in the country. So that is a challenge, but it's also an opportunity, because it means that we can think big and perhaps come up with new ideas that sometimes smaller organisations would find more difficult to find the money for. And we've got a really strong knowledge of local commissioning within the 4 localities of Herts Valleys. There was a very strong tradition of something called practice-based commissioning, which preempts the CCGs. But I think the big difference here is that our local population are going to be helping us to form our strategy. So at the heart of our commissioning process is safety and quality. If we don't actually address that, then we will have failed. And so in all of our committees, everything that we think about, we're thinking about the safety of the organisation and the quality. And one of the things that you'll notice on our website is there's I think it's called You Say We Heard, or it's a little button that you can press. You can let us know what you think about organisations. Have you had a good experience? That's so important to hear. Have you had not such a good experience? We want to hear about it all. Underpinning that is that partnership work. And around the edge here, and I'm not going to go through them all, are all the people and the areas that we're dealing with. But most important to mention here, it's clinically led, it's focused on outcomes, it's locality driven, so we're not forgetting about the localities because they are different, they do have different profiles, but it's patient focused. I mean, for those of you who don't know, our PPI group now has got how many members? It's about, I think we've got 600 on our network. It's something like that. It's head over around. Yeah, it's even higher, is it? Okay, it's going way up. Good, good. Okay, next slide. Okay, so some of our challenges here. Well, we've put them into quality, leadership, relationships, and long-term strategy. And just some examples. Well, strategic. Well, we cannot not mention finance. As an organisation across, lots of CCGs are like this, it's not just us, but we've got real pressure on urgent care. And a lot of money at the moment is being spent on providing for that urgent care. Our challenge is to find better ways of hopefully preventing the need for urgent care, and if people do need urgent care, working in the most efficient ways to get them out of hospital and actually bringing them back home. Quality, well, we must mention here patient safety, infections, hospital-acquired infections such as C. difficile. This is really important. We're working with our providers to try and hopefully make a safer environment for you to be in. Leadership we've talked about, and really what I want to say now is that although this is a new organisation, we are taking the best of what was there before, we are working with it, and we're now moving on to the future. But the difference between now and then is the fact that you are there to help us to shape this sort of care. Okay, a little bit about Quick. Now, I don't know if those of you have seen the news this morning, but Chris Hams, who's I think he's Chief Executive of the King's Fund, has really mentioned that we have to think radically about how we deliver healthcare in this country. And in our area, in Herts Valleys, we are probably looking to find about £20 million in the 2013-14 financial cycle. That is massive, and it's achievable, but it will only be achievable if we actually find better, more efficient ways of dealing with healthcare for all of us, and really thinking outside the box, and that's what today is about. I just want to mention a couple of things. Unplanned care, we're doing some innovative work with HCT, Hertfordshire Community Trust, our community provider, and with the local council, social services, to deliver a project called Home First. And what this is a sort of a virtual ward of the patients, people who are most likely to require a hospital admission or urgent care. And we're actually looking to identify them before they actually get to the stage of needing to go to hospital. So this is a really good bit of work between GPs and all the other people that we've mentioned to try and prevent that. Several examples of this nationally, and if that works, that will probably be a way in which we will hopefully deliver community care better outside. Next slide. Now, this is our financial budget, which is £650 million, and I think the thing that I want to alert you to here is that our spend on community services is only, I think we put it down, is it 8% or 8%? Yeah, 8%. And that is low nationally. So I think as an organisation, what we really want to happen is we want to see more investment into community type services. And that's the challenge that we've got. How do we do that? Hopefully you will have some ideas later on to talk to us about. But we don't want people to be getting their care delivered in hospital unless they need it. If they need it, they need to have the best quality, timely treatment. But ultimately, by expanding the community care that we're delivering, that is the way that we'll hopefully get better outcomes for patients. Next slide. Okay, I don't make any apologies for talking about our areas of greatest deprivation. Because it is a challenge. And in Watford, we've got the town centre, we've also got South Oxley, Hertsmere, where I'm a GP, big pockets in Boreham Wood. And we have got to address these. And that may mean, and I think we have to be absolutely upfront about this, there will be perhaps some areas that we won't be able to invest as much money in as we have in the past. So the challenge for us is how can we get the same health outcomes? If you like, back to Louise's slide, how can we move the care so that the outcomes, the health outcomes, are as good as they are now, but actually hopefully spend a little less money so that we can actually free up that money to do some other more exciting work. A little bit about jargon, and apologies for this. It's called the Joint Strategic Needs Assessment. This is the health needs that we have, our population, you, the public, have. And all around here, you'll see areas which contribute to it. And I won't go into detail about this, but this includes our providers, our schools, community organisations, Health Watch, health and care commissioners. Everybody contributes to defining the health need. And over time, we will refine that so it's better. I think the word JSNA immediately switches off. And I think Mark, who is leading on that, we're hoping to get a more sort of people-friendly title, but I don't think we've actually got a name for it yet, have we, Mark?
Today, I'm sure one will.
Yeah, okay, now this is the challenge that we've got. If that top line there is the health outcome that we want, as in excellent treatment, that's not, we're not trying to go for second best, we want excellent results. In some areas where there is low deprivation, they already may have achieved the good health outcomes. But in some of those areas of high deprivation, be it on an individual person, or in a locality like we've just mentioned, we've got to actually put some more finances into that in order to get better health outcomes. And if it's not finances, it's about ideas, it's about working more effectively. And that's the challenge we've got. So this isn't going to be an easy conversation. And if I was to say otherwise, I'd be lying to you. So today we've got to try and actually look at what areas not only do we want to invest more in, but maybe what areas we can spend better in. And that's the challenge that we've got. It's actually about both areas. And that's the difficult sort of conversation that's happening nationally, and we've got to have it in Hearts Valleys, or we will run out of money. Okay, on to the next slide. Okay, a little bit about the local landscape. Now, we mentioned about the HWB, the Health and Wellbeing Board. This is an incredibly powerful vehicle to help to address the health needs across Hertfordshire. And as Louise has said, I'm one of the members of the Health and Wellbeing Board, and we will talk a lot about how we can work and get the best health outcomes in this board. So already we've talked and identified some of the big areas: mental health, end of life, dementia, smoking, obesity, all of those areas we're going to be looking at the Health and Wellbeing Board. So if you want to contribute to these discussions, you need to get involved and tell us what you want. Okay, on to the next slide. Now, out of today, this is where we get a bit more jargon, we need to form what's called an integrated plan. If you like, what are we going to be doing in the future? How are we going to be spending our money? What are our clinical priorities? And that's not only for this financial year, but it's actually beyond even 2013. It's over 5 years. So the work that you'll do today will help to shape that. And as I said, I can't stress enough, this is your opportunity to influence it. Okay. So we talk about the golden thread. There's some posters up there. What do we mean by that? Is that when we've established what the needs of our health, of our population are, well, that's fed into the Health and Wellbeing Board strategy, those 9 areas that Louise mentioned. And then we look at how that shapes our local priorities and then our wider Hearts Valleys priorities. And the one really good thing about Hearts Valleys is that we have not forgotten our localities in answer to your question. A lot of decision making will be local as well as across Hearts Valleys. We think that's terribly important because we do realise that different localities have different needs. Okay, I think that's it. Okay, thank you very much.
Thank you.